Brigman of the Canine Coach Carolinas and have with me again today Dr. Barb Fox, and we're going to be spending a little bit of time talking about joint health and things that you all need to look out for and things that you can do to support your dogs. But I'll start with allowing her to spend a minute introducing herself and tell you about her practice and the books and training that she has available that you can leverage for all things holistic health with your pets. So Dr. Barb, a short intro if you would.
Hi, everybody. Dana did a wonderful introduction, and I just want to tell people that I've been in practice for 28 years, and for the last 14 years, I've devoted my practice to mainly holistic medicine. And I created a movement. I would really like this movement to take off, called the Natural Animal Health Movement, because I really feel like you just said, Dana, you want to get away from the pharmaceuticals as much as we can, get our pets and our animals on a natural plane of health. Mm-hmm. And I really feel very passionate about this. So I do, or have created some online courses, and my website is simply Barb Fox DVM, Dr. Veterinary Medicine, DVM.com, where you can go and you can look at courses on nutrition. I have some essential oils in cats, essential oils in dogs, and essential oils in horses courses. And these are things that you can work through at your own pace. There's no time limit on this. You have lifetime access to the content there. And I intend to update it as I go. I've written a couple books too, and I don't really want to get into that. You can go to my website and get the information about the books there. But the big part of my practice is doing online or telemedicine, which is online and phone conversations where I consult with you about your pet using natural products. So
right.
That, in a nutshell, that's what I do.
And so on Barb Fox DVM, if they had a need for an online consultation, they can get to you through that site as well?
Yes, they can. Mm-hmm.
Perfect. All right. So Dr. Barb has joined me for several other podcasts, and I encourage you to go listen to all of them because they're absolutely fabulous with her knowledge and her guidance and expertise on helping us down this path of natural wellness. But one of the things I wanted to talk to her about today is joint health and dogs and the issues that we're seeing. As a trainer, I run into people with dogs who have joint health issues and ACL issues all the time, which I know is not a joint, but they are connected. And people don't often recognize that their dogs are even having some areas of discomfort or what they can do about it in this line of natural wellness. So, Dr. Barb, I just want to talk a little bit about some of the types of joint issues that you may see in your practice, things like arthritis or hip dysplasia or Wobbler's disease, which we used to see a ton of in the Great Dane rescue area. I know my boxer friends run into degenerative, and I can't say it well, degenerative myelopathy. Am I saying that right? And
myelopathy.
Myelopathy. I always screw that up. And then, of course, my dachshunds, the dachshund breed is known for back issues. So can you tell us a little bit about, some of what these diseases are and what we should be looking out for?
Well, Dana, there's so many of these different diseases and conditions out there. I'm sorry for the background noise. I have a very bored cat right now in the background.
That's okay. We're all familiar with working from home.
So we can kind of group all of these disorders when you talk about either wobblers, which is, a stenosis or a narrowing of the spinal canal in the neck vertebrae. We can talk about arthritis, degenerative joint disease. Basically, it comes under joint disease in general.
Okay.
We fix different names for, like, hip dysplasia is dysplasia means it's abnormal. It's abnormal formation of either bone spurs or degeneration of bone, in the hip area. So I try not to get I just try to stick with the broad terms.
Right.
When we talk about arthritis means arthro, which is joint, itis meaning inflammation. So If you have osteoarthritis, that just means you have bone inflammation.
Gotcha.
So it's distracting. Oh my goodness.
We don't even hear him, just so you know.
Oh, okay. Okay. And so like even in horses, when you have developed, let me break this down into age groups. So like when we talk about young dogs having joint disorders, it's usually from a deformity in the joint from either overnutrition or undernutrition or the immune system going haywire. And so I know we're going to be getting into more of this, but I don't look at genetics so much as I look at the vaccine schedule, what that dog is eating, what its intended use is. You know, if it's not getting enough exercise, obviously we're going to have issues. So yeah, let's break that down a little bit, and because I could go down a lot of rabbit trails right now, and I want to stay focused.
I actually my body just washed over with sort of this chicken skin cold chills thing, because I'm astounded. I don't think I've ever heard it put in terms of a nutritional issue. And that's a big deal, right? I mean, I was part of Great Dane Rescue for many years, and we saw so many dogs with hip dysplasia and wobblers. And I think I always believed it was genetics. So tell us more. I'm ready for for the download.
Okay, so Dana, you are very astute on nutrition, and you understand that dry kibble food or processed food has a lot of dead material in it.
Right.
And I don't mean dead as far as decaying and that kind of thing. I talk about dead food not having enough nutrients in it. Because when they process, when we feed dogs a processed dry kibble food, it is sent into this huge extruder machine. And it is, what they do is they take the meat products, byproducts, whatever they can scrape off of the floor, along with, depending on the quality of the food. And then they mix that with some oil and some water, and they'll put their, starches and their grains in there, and they put this in this extruder, which expands this stuff into like a dough. And then it's pressed at very high temperatures and very high pressures through a machine that makes the kibble. I'm putting this as simply as I possibly can.
Right, I understand.
But when that happens, and for the people out there that don't know, about 90%, maybe 95% of the nutrients are destroyed. And then what the company has to do is they have to spray a synthetic mineral vitamin mix onto the food.
Right.
And then it dries. So, and we all know that people, animals cannot use synthetic vitamins. I mean, the body just goes, hey, what's this stuff? Now, it might absorb a little bit of it, but about 10% is all that those animals are going to absorb. So when we have a puppy, especially a large breed puppy, they tend to grow too quickly anyway. That's genetical. That's genetics. That's, So when they grow too quickly and we are feeding them a nutritionally imbalanced food because of the synthetics, and we don't know what they're getting or what they are getting, then we can have these issues come up. Now, it's not just the large breed dogs that get hip dysplasia, or well, I shouldn't say hip dysplasia, but arthritis in general. Almost any dog can develop joint issues anywhere in the body. But these cranial cruciate ligaments, I knew it as ACLs, anterior cruciate ligament, in vet school, but now they've changed the term kind of to cranial cruciate ligament. They have to change things up every now and then, I guess,
for whatever
reason. Right. I totally believe that this is a nutritional thing as the major factor. And then when we start putting chemicals on our dogs, whether it's flea and tick, heartworm preventatives that are chemicals, and then we shove every vaccine in them that we possibly can, what does that do to the body? And so if you think about it, everything is related. Everything is related in our body. You can't separate the pancreas and the stomach. There's no space. If you open, like you're doing surgery on the dog, you open it up, there's no space there. Everything is touching. Our bones, Oh, let's back up to a joint, because a lot of people don't understand what is actually in a joint.
Okay.
In a joint, we have synovial fluid, which lubricates the end of the bones where the cartilage lies. And you have cartilage in there. And then we have ligaments, which are strong fibrous bands that hold the bone to bone, like the radius to the ulna and so on and so forth. And then we have tendons. And so all of our muscles are also attached to the bone by this fibrous material. And we have collagen in there and some other things.
Mm-hmm.
So if you think about whether it is a cranial cruciate tear, whether it is a meniscal tear, whether we have damage to the cartilage, we even have a fracture, it's all related. Does that make sense?
Yes, ma'am, it does.
Yeah. And so then all these things that we're doing to the body, as far as putting the chemicals and whatnot in there, this all affects how those joints and those bones grow and how they're affected, how our the collagen in the cartilage is manufactured and held in what I want to say, an organized frame.
Mm-hmm.
So, you know, we have to think of everything there.
Wow. Okay.
And so the nutritional aspect, boy, there's so much I could go over. I'm sorry about that.
Take your time. Hey, I got all day.
So much.
I got all day. You can come back tomorrow.
This is what veterinarians don't teach their clients. And a lot of veterinarians don't even think about it. All we're thinking about, oh my gosh, my dog has hip dysplasia. Does he need a TLPO or TLPO? Or does he need, hip replacement? And we're not looking at fixing things from the inside out with nutrition and good things, supplements, essential oils that can support, maintain, and promote healthy structures.
Right. So if we think about a breed being predisposed, like I mentioned, I know the Danes are notorious for wobblers, even hip dysplasia, or Goldens with arthritis or hip dysplasia, and Dachshunds with spinal issues, IBDD or whatever. What is a predisposition relative to the breed? That is a genetic component, right?
Correct. That just means that there are certain strands of DNA that these dogs will, they're just predisposed. For the general audience out there, it just means that they're more prone, mm-hmm. or they have a greater chance of developing these things. Right. And you're right, it varies from breed to breed. You know, the Shepherds, Retrievers, the Labs, the Newfies, the St. Bernards, the Rotties, Mastiffs, Great Danes, and even the Old English Sheepdogs all have their their genetic predisposition to certain issues. Mm-hmm. So I'm glad the trend is changing, though.
Yeah, and I know epigenetics tells us that we have some influence of turning those switches on or off, or making sure they don't turn on. Fortunately, neither of my current dachshunds have ever had spinal back issues, knock on wood. So I'm thankful for that. The Danes that I owned myself never had hip dysplasia or wobblers. So I've been really fortunate. But when we think about these breeds in general, besides nutrition, what should we be doing proactively? And how early should we start?
Dana, I'm big for starting right out the gate. Here, I'm going to go back to nutrition. I know that you asked me besides nutrition, but I really think if we start our dogs on a fresh food diet, right off the bat and stay away from the processed food, you'll eliminate a lot of this epigenetic tendency toward, these issues. Mm-hmm. But, keeping your dog at a perfect weight, keeping your dog, I'm trying to say exercise, making sure that it gets not too much exercise and not under exercising, because we know that when puppies are growing, their bones are changing, and over exercising can be almost as bad as under exercising. Right. And some of these puppies that are coming out of a cage, they've been caged all all their little puppyhood life, and then all of a sudden they go to a new home, and then they're ripping around and tearing around. I think that may predispose them to some type of injury that can manifest itself in a worse situation down the road.
Mm-hmm.
But I am big on starting these puppies out on whole food supplements as well. There's one company called Standard Process, and they make what they call a whole food supplement. And this supplies all the macro and the micronutrients in the form of minerals and vitamins that these puppies need to stay healthy.
Mm-hmm.
And then we know that, that I love Young Living essential oil products.
Right.
And we've even started these puppies, I should say, about the 12 to 16 week period on Agiles. That product is great because it has turmeric, it has the undenatured collagen, it has the frankincense resin in it. So it's an amazing product. And I've got several breeders that just start right off the bat with these products.
Right.
And and then we've got to think about these puppies that are getting vaccines every 2 to 3 weeks from anywhere from 5 weeks of age all the way up to 18 weeks of age. That we want to make sure that we're using discretion in choosing those vaccinations, because vaccines really, people don't understand, but vaccines can cause, especially, and I was doing my research on this, I was really surprised. This was an article from 2004, but they just updated it last month. And they were saying, I gotta find my notes here, vaccines, especially distemper, can cause an autoimmune condition which attacks the collagen in the joints. Interesting, huh?
Interesting. I've not heard that previously. I'd love to maybe have you share that article with us so that I can reference it in our notes when I publish this.
Sure, I'll go through my history and find that for you.
Yeah, I'm a big fan of Agiles. And I think a lot of people tend to wait to start supplementing joint health, especially for the big breeds, until the dog reaches maturity or until they see a symptom, right? What happens if we wait till we're seeing symptoms to start supplementing?
Good question, Dana, because once you start to see symptoms, the damage has already been done. Mm-hmm. Not all of it. It may be mild, but you've already got damage by the time symptoms are being seen. And those symptoms could be something as subtle as just a slight gimp, or maybe they put one of their hind legs out at kind of a funny angle when they lay down. Even some joint swelling that comes and goes. We always think of infectious things like Lyme and whatnot, but it can be just inflammation in the joint from improper nutrition and or some kind of autoimmune thing going on.
So when you use the term damage, and I've used that many times myself, and we say damage is done, what does that actually mean? Is it the cartilage that's breaking down? The collagen is gone? Is it repairable? Or just we move into maintenance mode?
Well, let's start with what happens in the joint when you get these symptoms. So first of all, damage occurs to the joint in the form of the synovial fluid. And you remember me telling you this is what lubricates the ends of the bones where the cartilage is. Mm-hmm. Okay. So when the synovial fluid gets inflamed from trauma or an infection or whatnot, autoimmune thing, then that fluid, instead of being like motor oil where it's real thick and viscous, it gets watery. And at that point, it doesn't have the ability to carry nutrients to the cartilage to keep it healthy. The cartilage then starts to degenerate. And then once the cartilage is degenerated, this is very simplistic terms here, but once the cartilage starts to wear off and you have bone rubbing on bone, that's the end result. And that's the end of the joint, pretty much. Now, it takes sometimes a very long time to occur, but we have to keep that synovial fluid very healthy.
Okay. So when people are thinking about supplementing, and again, I hope people are hearing us and we say supplement early, not after you see pain or a sign of a problem, right? Do it ahead of schedule. So besides the vitamin mineral supplement you were talking about, because I think we would have to get a supplement from a veterinarian. Is that correct? Right.
Yes. Mm-hmm.
So I have a great vitamin mineral supplement as well, and I'd love to get your opinion on it from Volhard, which we think is fantastic. But people often go and shop for over-the-counter omega-3 or over-the-counter glucosamine and MSM. Tell us your theories or why that may or may not be our best option.
Wow, you opened up a can of worms here.
Thank you. You're welcome.
This is good because I'm very opinionated on this subject.
I like opinion. That's why you're here.
Okay. First, let me tell a story first, and then I'll tell you why I'm going here.
Sure.
Okay, so a couple years ago, when I still had my physical office open, I had this lady that had a dog that was scratching so badly. It kept her awake at night. She was having to take 2 sleeping pills just to get through the night because the dog was scratching itself.
Through the dog scratching? That's terrible.
I know.
I would
and she couldn't
with my dog.
Well, she had been seeing a conventionally trained veterinarian, and he had it on a prescription dermal diet, and steroids and antibiotics, about 6 courses. And of course, when the dog was on the steroids and antibiotics, it didn't scratch.
Right.
And when it was off, then the symptoms came back. So she went online and bought a bunch of stuff. And then she set up an appointment to see me because she was so frustrated. I kid you not. She brings in 2 big, like Walmart plastic sacks full of supplements.
Oh no.
I had, and she throws them down on the exam table, spreads them out. She says, what do you think of all these? I've been buying this and then buying that. And I don't know what's working and what's not.
Right.
And I looked at her and I said, Carol, I don't know what these things are. I honestly can't give you my opinion on it. And here's why I say this, because I took her off of all of those things. And I said, Carol, I only use 4 companies' products, 4 companies, because I want to know, do they have a veterinarian on staff that can answer my questions? Do they have a support staff? There's one very popular dog nutritional kind of mix that you put in, is supposed to help with itching. They don't have any nutritionists there. They often, and they also told me that their founder doesn't even have a nutritional degree. So I'm like, okay, red flag right there. I want to know, is the product endorsed by other veterinarians? And, I want to know where the products are sourced. I don't want anything coming in from China.
Right.
I want everything made in the United States, and I want it backed by, I don't care who writes a gazillion, 5 million testimonials. Anybody can write a testimonial.
Sure.
But I want real solid evidence that these things work. So Young Living Essential Oils is one. We have, actually a whole host of veterinarians that we kind of have a network, and we share what works and what doesn't with our animals. Do you want names of companies, or can I say that on here?
That's up to you. It doesn't bother me.
Okay.
Yeah, it's fine with me.
Okay, I mentioned Standard Process because they have veterinarians and veterinary technicians on staff, and their products are backed by veterinarians big time. They have a whole veterinary line. And then I use RX Vitamins. That's Dr. Robert Silver that founded that company. And he has provided a lot of the continuing education classes on nutrition and supplementation. And he's just a walking computer about all the nutritional aspects. And gosh, who else have I used? That's pretty much it. I guess so. It's 3 companies' products. Yeah. And I don't want to get to the point where I'm having to research a gazillion different companies, because if I'm not familiar with where they're sourcing things, if they can't reveal that to me, or if I don't even know where, like I said, what's in these things for sure, because they aren't regulated by the USDA or the FDA, then I want to stick with things that are tried and true, things that I've used in my own animals and I know they work. Right. So anyway, when I took,
go ahead. I'm sorry.
Go ahead.
No. I was going to move into a question. I don't think you're finished with this one, so continue.
Well, I think this is so important, though, is that people need to work with a holistic veterinarian, or call the company and do your own research before you go out and buy a product that 5 million of the people use, because that doesn't tell me anything. Anybody that's any good at marketing can say what they want.
Right.
That doesn't mean it's good. And so going back to the little dog that Carol had, we took him off of all of those products, and I put him on sulfurzyme, which is a Young Living essential oil product, because that's really good for hair and skin.
Mm-hmm.
And then we gave him Ningxia Red, like an ounce a day of that, and had him on, I believe we had an omega-3 fatty acid product. That was one that she had, and I looked at the ingredients and I looked at the company and I thought, well, this is pretty good. We'll keep her on that, or keep him on that. And then we used essential oils and had, diluted out with the V6 oil, and then had her being shampooing the little dog in the Animal Sense from Young Living, the shampoo and so on and so forth. And that dog, she called me a week later. She says, I am so excited. After and then, I'm sorry, got to back up. Got him off that prescription diet.
Right.
That was dry kibble,
Right.
and got him on a homemade food, and he did not scratch after that at all. It only took a week. Now, that was an extremely successful case. Not everybody is going to have their animal respond that quickly, but this worked. And so here again, she spent probably $500 or $600 on these supplements, and her dog was not getting any relief.
Yeah.
That's my little mantra there.
Right. So in short, typical over-the-counter glucosamine, MSM, and omega-3 may not be our best options. Do you agree?
Over-the-counter means, to me, synthetic.
Okay.
And you are going to pay a little bit more for a quality product, but it is worth the time and effort to do your research.
Right. So in other words, Costco, Walmart, not our best options for good, healthy products.
Absolutely not.
In general, what does omega-3 do for joint health?
Dana, I would really have to get out some notes and look at that, but in general, omega-3 is an anti-inflammatory, antioxidant type of product.
Mm-hmm.
And the problem is with a lot of your omega-3s and omega-6s, they have to be balanced. And a lot of products aren't balanced, and foods aren't balanced. In other words, like if we eat a lot of olive oil, we're going to be high in omega-6s, and that is pro-inflammatory. Mm-hmm. That's where we have to have our omega-3s come in and say, let's clean up or let's get balanced here, because we need both the 3s and the 6s.
Yep.
So
and I would say to people too, and feel free to comment on whether I'm right or wrong, but I think I'm right. Chicken diets are extremely high in omega-6, which can be a problem for our inflamed or challenged dogs as well. When we think about it from even a Chinese medicine perspective, it tells us chicken is hot, that chicken is pro-inflammatory. Do you agree?
Right. And I think, yes, but not to the extent that, our beef and other things are. Even lamb, like a lot of the first allergy formulas that came out had lamb in it, and lamb is actually a heating type of food. Right. So we have to, and sometimes turkey, I believe, is a little less on the omega-6 category than chicken. Yeah. So some dogs may not be able to eat chicken, but they can eat the turkey.
Exactly. I see that all the time, that turkey works and chicken just creates a mess. So, okay, let's see. When our clients what are they looking for? I know you mentioned it might be a little bit of a limp or a gimp or a gait issue, but what are some of the more extreme things that they may see with some of these really complex joint health issues?
So some of the symptoms, Dana, could include the inability or what they'll do is have trouble navigating steps. Perhaps they'll be running after a ball and, tweak something, stumble, exactly. Sometimes dogs will drag a little bit of a hind leg, not to the point where they're actually towing over all the time, but mainly it's just that gimp,
Yeah.
which,
I've seen
especially in the
dogs
morning.
where the gait seems like a leg is almost swinging, like it's not in alignment, but it sort of makes this funky little pattern as they're running, almost this rotation, if you will. And I'm assuming that's a rotation in the hip area.
Right. The body's going to put itself wherever it's comfortable and in the best position where you're getting some relief. A lot of people forget to look for muscle atrophy. So maybe say that they've got a real mild partial like ACL or CCL tear in their left rear leg. If you compare the left rear leg over time to the right rear, you'll notice that it looks thinner. It looks narrower. Maybe there's just not as much mass there and the bones are easier to feel. That is a very subtle process. And a lot of people don't know that till I point it out to them. I'm like, oh my goodness, there's a lot of muscle loss here.
And so, go ahead. I interrupted again.
No, that's okay.
Oh, well,
no, that's okay.
I was just going to say, Poppy, my pit bull, she blew out her back left ACL before she was 1 year old. And
wow.
Yeah, but she's wide open. And she would do those pivot turns and all sorts, and she blew that leg, but she wasn't even a year old. And she, obviously in the rescue space, so I'm sure she didn't come from the greatest of nutrition or any of that kind of stuff, because she and her mama were found on the side of the road when she was 8 weeks old. So nobody was taking care of them. So a couple things in that, we did have to really work on rebuilding that left leg, because we could see the muscle atrophy that you're talking about. And the two back legs did not mirror each other in terms of muscular strength or size or any of that kind of thing. So what I've always heard is if a dog blows out an ACL, they are very likely to blow the other one. And why is that? What happens?
Well, there's two main reasons, Dana. The first one would be the same process, or the cause for the first one can happen to the other one. But here's what it makes total sense to me, is that now that good leg is overcompensating because the bad leg is not being used. And so all of the strength is coming from the good leg, and it just is overkill for it. And oftentimes they'll blow out that second one just because of an overbearing weight on it.
Yeah.
Does that make sense?
It does. It does. And which is why I've spent a lot of time since Poppy was, first blew out the leg, with essential oils and Agiles and all sorts of things, trying to make sure that didn't happen, and sort of, making sure that she's athletic but doesn't overdo it. So speaking of ACLs and the tear, is it TLPO, TPLO?
TPLO, right.
Sometimes we hear people say that we can heal a tear with essential oils. Can you tell us a little bit more about that?
I've had people do that. A good example was this little min pin that came in, and it was pretty overweight, and he just tore, I'm trying to think if it was a boy. Yeah, it was a boy. And he tore his left rear ACL. And he was too overweight to do surgery on. The client didn't have the money to do it. She wouldn't have put the little guy through it anyway. And so basically, she didn't have a lot of money, like I said, but I gave her some essential oils. I made a little blend, and I said, I want you to put this on 3 times a day. And I think we had like wintergreen, copaiba, peppermint, black spruce. I'm trying to think what else we had in there. But the dog healed to the point where it wasn't limping and it wasn't in any pain. It wasn't 100%, but she gradually got some weight off of it, and he was fine. He did not need to have surgery. And same thing happened with my sister, or my nephew's dog. They have a German Shepherd, and he blew out his ACL. And I can't remember if it was the right or left one. But surgery was out of the option for them too. They had a baby coming, and they didn't have $5,000 to spend on that kind of surgery. So I did the same thing. We did, because he was so severe, I did put him on a prescription anti-inflammatory for about a week to 10 days, and then had them follow up with some natural products and essential oils, and he did fine. He's perfect. You never know anything happened now.
So does that
it can be,
go ahead.
It can be done.
Okay. Does that only work with a partial tear? Do I understand that correctly?
That's correct, because once it'd be like a rope. Once you cut a rope in two,
Once
can't
it's
be
severed. Yeah.
Yeah. Right.
Okay.
Yeah.
And how does having poor ligaments affect our joints? I'm assuming it's the same discussion of why it's very likely that the other knee on the other side would blow out. It's because of this compensation issue or not keeping it in place properly. Is that an accurate statement?
Well, going back to the first part of our talk today, the joint, when we talk about a joint, it's not just the junction of the two bones. It is the ligaments, the tendons, the cartilage, the synovial fluid, and the bone. That's what is made up of a joint. So we can't really separate like a ligament from a joint because it's part of the joint.
Okay.
Does that make sense?
Yes, ma'am. So I'm going to back up to the supplements for an example for a second, I should say, because I forgot to ask you about turmeric and the golden paste. I know a lot of people, and I've done it myself and have been a fan for quite a number of years, about golden paste for inflammation. Part of what I'm reading now about coconut oil is making me question that. So what is your opinion on golden paste for a joint health supplement?
Okay, so for the benefit of the audience, because I know you know all this, Dana, but for the benefit of the audience, so what golden paste is, it is turmeric that has some oil added to it and black pepper. And so why they do this is turmeric in itself is not very absorbable into the body. If you just take turmeric, like a turmeric supplement, probably 80% of it's not going to be absorbed. So by making the paste with the oil and the black pepper and the turmeric together, there's better absorption, up to 50 or 60% is what I've heard. I don't know if that's true or not, but that's what I've heard. So I think it's a great product, but if people are using it, well, you have to be judicial in what you use, how much you use, because in high doses, golden paste can cause some stomach upset. So, you know, there's a lot of different references out there, but turmeric in itself has tremendous anti-inflammatory properties. And a lot of people that take golden paste themselves say that their arthritis pain is greatly reduced. So it's a good product.
Okay. Any other supplements that ought to be on people's radar? I'm going to come back to the oils in a minute, but any other supplements that we should have on the radar? Any specific foods that would be beneficial? Besides
again,
fresh?
working, what's that?
Besides fresh?
Like you mentioned, the heating foods, if you can work with or even train yourself into just the basics of traditional Chinese medicine as far as what foods are cooling and what foods are heating. Anytime we have itis, arthritis, osteoarthritis, whatever, itis means inflammation, and we've got to cool that inflammation down. We think of inflammation as hot, and it is. So if we can get those foods into our dogs that are more cooling, like you mentioned fish, I believe in one of your Facebook posts, use a lot of fish. The only thing I will say about fish is you have to be very careful of the source. There are a lot of fish sources that are not good.
Yeah. No can.
But, you know, yeah, right. And so as far as supplements, I mean, there's a lot of them out there. Again, CBD oil is probably one of the greatest supplements because it decreases inflammation big time. That's one of the things that CBD oil does. And I'm not talking about the marijuana stuff. I'm just talking about the hemp oil and the associated products there.
Yeah. And I will tell you, Poppy has a big athletic day, right? When she has a big play date with somebody, the new CBD rub on her knees, she loves it. She thinks that's grand.
Yes.
And I like it.
That's
I like it on mine after a big day at the beach or
right.
something. Yeah.
Right.
So,
A lot of people use the oh, I'm sorry.
no, you're fine. Continue.
A lot of people use the like the glucosamine, chondroitin, and sulfate products. Again, if you're not using a really good product and you have, like you can, like the company I mentioned before, Standard Process, you can get scientific papers on their products if you request them. But for the majority of those, like you go to your Costco or your Walmart or whatever and you buy something off the shelf, I can guarantee you it is not going to be absorbed very well. And we don't even know how much, if it says 1,500 milligrams
Right.
in that capsule, do we know that there's 1,500?
Right.
It might have 50 milligrams, who knows? So that's the danger of going over the counter with a lot of this stuff.
Okay. My next question is going to open another can of worms and could be a whole topic in and of itself. But we are seeing a lot of pediatric spay neuter. And I think I'm seeing an association of dogs with joint health issues among other health and behavior issues that have been spayed or neutered really, really young. What are your thoughts on that relative to the joint health topic?
It's a very good question because now they are finding, they're doing studies and they're finding the early spay neuters. When you take the sex hormones or the reproductive hormones out of the body at too young of an age, then they're finding that these hormones are actually protective of the musculoskeletal system. Now we've taken those hormones away, that opens them up to damage and not any kind of maintenance. So those hormones are very important for that. And they say, I had a little statistic here, if I can find it real quickly. Oh, yeah, let me look here, Dana, real quick.
Take your time.
Because this is kind of important here. Oh, so this little statistic came out on one of the websites I looked at, and it says that dogs are sterilized before 6 months of age have a 70% higher rate of developing hip dysplasia.
Wow.
Isn't that interesting?
That's a big number.
Yeah, and then also the early spay neutering affects the growth plates. So if the growth plates, now the growth plates are the end of the bones where the cartilage eventually turns into bone.
Right.
And these growth plates shrink. But that you might have a dog with an uneven leg, like two uneven legs, they're not the same length. And so this is going back to how the vaccines damage the cartilage. And I was going to say there was another statistic I had here. Got too many notes. I love researching all this stuff. But basically it was saying like even the bones grow at different rates and they mature at different rates. Like the tibia doesn't fully mature, or fully grow or get done with its remodeling process for up to 18 months of age, where maybe the radius is 12 months of age. So now they're saying that, I don't know what the optimum age for spaying and neutering would be, but I would say a minimum a year and maybe even a year and a half.
Yeah.
For some of these, even your large breeds, I think they're saying 2 years of age.
Yeah, I think most people say when growth is complete, right? When we have reached maturity and are no longer growing. And then you probably know more about this than I do, but there are studies in males that say that that's even more important in the male than the female to make sure that growth is complete. So if we have an animal that has gone through pediatric or really early spay neuter, which is quite common now in my area, and I think in many other areas in the rescue world, and I understand why they feel the need to do that and, are trying to prevent unnecessary litters. But there is a trade-off for doing that. There is a consequence for doing that. So to our clients and audience that are adopting these dogs who have had early spay neuter, besides good nutrition straight out of the gate, as you said, with appropriate supplements from day one, not when we see a problem, not when they hit maturity, not later, but straight away, is there other feedback for them to consider?
That's a good question. Boy, I don't know how to quite answer that. It's a tough one because in a rescue situation, for the reason that you mentioned, but veterinarians are still brainwashed into thinking that they have to be spayed and neutered at 6 months of age, or 12 or 8 months of age before they have their first heat. And in a little bit of that defense, Dana, the younger animals do heal better from that surgery. However, then we have to look at the long-term consequences as far as the skeletal system, what we're doing to it, what we're doing to the other organs that are dependent on some of the sex hormones.
And their behavior. I deal with the behavior side of it every day.
Right. And so I don't know what the exact right answer is, but I see too many people waiting until like an animal is 6 or 7, 8 years of age, then they want to get it spayed because it's developed a mammary tumor or a pyometra, which is an infected uterus, whatever. So I just think that I think there's a happy medium though, that, we can wait until the animal's actually considered an adult and then do the spaying or neutering at that point, and eliminate a lot of the issues there.
Yeah, but I think, just to recap, our best advice, or maybe your best advice, for a pet parent who has adopted a dog that has already been neutered at what we would call a pediatric spay or a pediatric neuter, the best thing they can do for that animal is great food and appropriate supplementation early. Is that fair?
Right.
Okay.
Correct.
I want to go back to essential oils before we wrap up. You mentioned wintergreen. I love wintergreen. Poppy's knees love wintergreen. But a lot of people panic when we talk about wintergreen and our dogs because of its coagulation issues. Can you discuss more about that and how we would use it, why we would use it in this case, and maybe, how much or how to dilute it is a better question.
Okay, wintergreen is an amazing oil, but a lot of your wintergreen out there on the market, now Young Living has the best wintergreen I've ever come across. But wintergreen is oftentimes adulterated and it's synthetically produced. And this is the danger with wintergreen. Now, wintergreen would be no different than giving your dog an aspirin. It would be better than giving an aspirin. But both aspirin and wintergreen, because here's the deal. The salicylate in wintergreen is the component that we make aspirin from. So salicylates do thin the blood. And this is why people with heart issues, or too thick of blood, why they are on blood thinners or on aspirin, because it thins the blood. I don't think you'd have to probably use a lot of wintergreen to get, a lot. Right. To get a coagulation or a clotting disorder going. I really don't think that that's an issue, but I think it's more the safety issue from the adulteration aspect. So wintergreen is what I consider a very strong oil, and you'd want to dilute it for even a large dog, 50%. I'm talking about even a larger giant breed, diluting it 50%. Of course, for the little guys, you want to dilute it 75, maybe 80%. And that way you won't have any issues with that. Clove oil is the same way. It also thins the blood, and it's a very hot oil. So if you're using clove, it's a tremendous antioxidant. It's very high on the free radical scavenging scale, which means how fast does your body rust, yeah. Right? So, maybe the oils, we have to think about quality, and we can't go down to the local co-op and buy wintergreen or lavender or whatever they have on the shelf for $4 or $5. That's right. Not a true oil.
Exactly.
Yeah. I know you know that.
I know that. I want everybody else to know that. But Again, I want them to hear me say, like with Poppy, when she blew out her knee, and then on days when she has these big play dates, I put wintergreen oil on her knee directly with a little bit of coconut oil and call it a day. Right?
Right.
It is not a big deal. I am not afraid of it, but I'm not doing that all day, every day. I do it on an as needed basis, and we have never, ever had a problem. Copaiba is another one that we use for everything, topically and ingestible. Do you think Copaiba is a good for joint health for dogs to ingest on a daily basis?
Very, very much so, Dana. Copaiba has a very mild scent, a very mild taste, has tremendous anti-inflammatory properties, and it is on the high end of the what we call the GRAS scale, generally regarded as safe. So you can use pretty much a lot of that. Now, some people, and I don't know about animals, but if you take a large amount of it in my mouth, you might get a little upset tummy. But, you know, everything in moderation. Start out with a little, and as your animal or yourself tolerates it, then you can add more.
Yep. I stir it into my dog's food. I'm one of these that I'll do things for a couple of weeks and then I'll rearrange what I do. And then I'll go back and do the same things for a couple more weeks. But I like the rotation of things and the variety of all things in moderation, so to speak. But Copaiba gets stirred into my dog's fresh food diet on a regular basis with zero issues. And I believe that's part of why I have a 15 and a 17-year-old that are as healthy as they can be with no back issues or joint issues. And that is a contributing factor in my opinion. So wintergreen, Copaiba, what other oils? Is it black spruce that is right for that? Are there others that are? Lemongrass is also great for our ligaments, yes?
Mm-hmm. Yes, very much so.
What others might we add to a concoction for supporting our joint health in our animals?
A lot of people don't talk about this, but I love the tree oils. I love pine. I love the black spruce, the Idaho blue spruce. Help me out here. I'm doing kind of at a blank. But any of the tree oils they, especially the spruce, they have very highly anti-inflammatory properties. And so anytime, going back to that, you have an issue with inflammation in a joint, then we want to find the anti-inflammatory oils. Now you mentioned lemongrass. Yes, it's very good for soft tissue, connective tissue, strains and sprains. It does stain though, and it has to be diluted out. It can be an irritating oil. Right. So I use that probably a little bit less. Now, when I sprained my ankle, or I broke my ankle a couple of years ago, I didn't know I broke it, but I was putting on a lot of lemongrass. I had a very orange ankle for a long time, but boy, it really helped.
It's been surgery.
Yeah, right, exactly. But peppermint, we can't forget about peppermint either. And peppermint is another strong oil, but tremendous anti-inflammatory, pain relieving types of properties to that. And then also but people have used it on bone spurs, horses with bone spurs, dogs with spurs in their vertebrae, and have had really good pain relieving success with that. And again, I can't say enough about sulfurzyme.
Yeah.
Go ahead. I'm sorry.
I was going to say, let's not forget Valor, that we tend to say resonates with the frequency of bone, or some call it chiropractor in a bottle. So it's certainly a benefit for those issues as well. So what is sulfurzyme for us?
Sulfurzyme is one of these these supplements that, for one thing, helps the collagen maintain its integrity. It also regulates water balance inside each cell. So when you have inflammation, oftentimes you have these cells that are kind of swollen. That's where your pain comes from. So sulfurzyme helps regulate that water balance so that it's not pain. It will help decrease the pain. It also is really good for immune support. And I don't know, there's a ton of different properties to sulfurzyme. I just know that the MSM, which is a natural sulfur, it's naturally occurring sulfur. It's not sulfa. So people go, oh, I can't take sulfurzyme because I'm allergic to sulfa. It's not sulfa. That's a synthetic drug. But we all need sulfur in our bodies. And from what I understand, this really helps with inflammation as well.
Mhm.
So I'd have to probably get a PDF and go through everything on sulfurzyme, but it's just an amazing
one of the other
product.
big things is it has the ninja wolfberry in it, which is great for all things antioxidant. So it's just
Correct.
a good all around supplement for everybody and every dog. I don't know about cats. Could cats take sulfurzyme? Because I know dog mamas have cats too sometimes.
I don't think it would hurt a cat, but it's very bitter. If you pull the capsule apart or use the powder, it's kind of bitter. And cats, you know, they have this really big taste aversion to a lot of things. So, but I know one of my colleagues' cats loves to drink Ningxia Red right out of the bowl.
Mm-hmm.
So,
okay,
go figure.
Well, I think that covered most of the questions that I had, or all the questions that I had. Is there more to add that you would, you know, think we need to hear about before we depart?
Let me see here. I just am going to reiterate a few things, if you don't mind.
Please.
That you should never feel bullied or pressured into vaccinating your animal for everything under the sun if you feel very strongly against it. And I think we've talked about this before in a previous podcast, haven't we, Dana, on vaccines?
Mm-hmm. And we will again.
Okay. Because I really feel, I'm not an anti-vaxxer. I still vaccinate, but I'm very much into education and information about how vaccines work and the implications, the vaccinosis issues. And going back to, well, let me just extrapolate on this a little bit. When we vaccinate our animals, we can have these long-term issues with either autoimmune diseases, cancer, arthritis, neurologic issues. Nobody can there's no way to prove this scientifically that a vaccine causes these issues. We just call it idiopathic, meaning there's no known cause for it.
Right.
But if you look at how a vaccine works and what it does to the body, you have to be very discerning on which vaccines you choose, and choose titers instead of just doing everything under the sun on that little reminder card you get in the mail for your dog.
And know your risk for what you're vaccinating for. Meaning, if your dog is an indoor dog that goes potty on a pee-pee pad and is never outside, you don't need the Lyme vaccine. You know, right?
Right?
You don't have deer in your backyard. Like one of my clients legit lives on an island here down, you know, in the coastal area, and they're like, there's nothing here. And I'm like, then you don't need the lepto vaccine, you know. So we have to think about what is the risk, and, you know, is that vaccine even really necessary? And if you have a risk, how severe is it, and how treatable is the illness?
Right. Exactly. So is the vaccine a bigger risk, or is the disease a bigger risk?
Right.
I see dogs all the time reacting to leptospirosis vaccines. And, you know, then we go like you just said, if the dog doesn't go out, doesn't drink out of a farm pond or whatever, does it really need lepto? Right. So you have to do your research, guys.
Exactly. Awesome. Okay. So thank you. I have learned quite a lot. I think I know a couple of things, but certainly not to your level. So I've learned quite a lot today, and I'm excited about that. And I hope that our audience finds this really helpful as well. So those of you watching this, we've been talking with Dr. Barb Fox. She is in Iowa, but she does online consultations. You can find training classes, information about her services. And if you haven't read her books, I know she didn't want to tout them at the beginning, but they are fantastic. We actually covered one of them when we did the emotional discussion on a different podcast. So go to Barb Fox DVM.com for all things Dr. Barb. And if you need her, she's available to help you online. Any parting words?
Thank you, Dana.
It's been
Just
my
thank you so much. And well, I'm just thankful for all of your listeners as well.
Yeah, me too. Thanks, Dr. Barb.
You're welcome.